Hi everyone, I'm Dr. Keith Ungar. Welcome back to our Ultimate Thyroid Health video series. This is video number 3. Hopefully you've already watched video number 1. It's an overview of the thyroid, and video number 2 is on Hashimoto's. This video is titled, Why Isn't My Doctor Helping Me? Now I'm not going to beat anybody down here, but we have to realize that our approach is different than traditional medical model. You get that? So we look at things from a different standpoint. We look at things from a functional standpoint. In other words, we look at how the whole system is functioning, not just the thyroid gland itself. In video number 2, we talked about how when most patients start having thyroid-like symptoms, they go to their doctor and they have a TSH test run. That stands for thyroid stimulating hormone. If it comes back elevated, they're told they're hypothyroid, and usually they're put on either Synthroid, levothyroxine, or Levoxol. Then they're told to come back to the doctor in 8 weeks, and they run your TSH level. And it's back into the normal range. And they say, see, your TSH is now normal and your thyroid is fixed. But you say, doctor, I still have all my symptoms. How come I still have weight gain? How come I can't lose weight and I exercise 4 or 5 times a week? How come I have thinning of the hair? How come I'm still constipated? How come I still have dry skin? So in many, many cases, patients are taking their thyroid meds and basically they're still having all their symptoms. Okay? So don't think you're crazy, because they haven't tested you properly to see if there are other causes for your thyroid condition. The TSH test, even though it's considered the gold standard in conventional medicine, it only measures 3 out of the 10 metabolic thyroid steps. You can find out more on that in video number 1. What happens if the other 7 steps are broken down? They're not testing for that, so those could actually be affected. So basically what I want you to do is, if you haven't watched thyroid video number 1, go back and watch it, okay? So a lot of you don't just have a thyroid disorder. You have an autoimmune disorder. It's your immune system attacking your thyroid. So it's your immune system that must be addressed. Even though thyroid replacement hormones are necessary, because too much thyroid tissue may have been damaged or destroyed, and you may have to be on levothyroxine or thyroxol. Now it often happens that a person with Hashimoto's get their TSH levels back into a normal range with their thyroid med, but yet their symptoms are still present or maybe getting worse. So they always ask me, Doc, why am I still having my symptoms and my blood tests are normal and I'm taking all these meds? The reason is that you likely don't have a thyroid problem. It's an autoimmune condition. You are very familiar with the symptoms. Fatigue, being cold all the time, constipation, weight gain, thinning of the hair, losing the outer third of your eyebrow, anxiety, depression. How about brain fog or mental sluggishness? Do you ever walk into a room and wonder why you went in there? Or maybe you're having difficulty focusing on a certain task, or it takes all your effort or energy to focus on the task at hand to get it done. That's brain fog. The list goes on and on. Even worse, your doctor starts treating the symptoms with different medications, and they all have side effects. For example, if you tell your doctor that you just don't feel like your old self, then your doctor may prescribe you an antidepressant. Or if you tell your doctor you're having trouble falling or staying asleep when you go to bed, then what do? They may put you on a sleeping pill. It's crazy. Why not ask the right question? What is causing your symptoms? Well, here's another problem. The vast majority of physicians out there think that thyroid patients are literally out there, or they're out of their mind. How do I know that? I can't tell you the number of clients that have told me that their doctor said, it's all in your head. Or they say to them, you need to see a psychiatrist. That's sad, because they think they were told that they just need to go out and exercise or take an antidepressant, or they have some psychosomatic illness and that's going to fix them. Well, really it doesn't. So literally, they think thyroid patients are nuts. Do you know why? Because 90% of hypothyroid or low thyroid is caused by Hashimoto's thyroiditis, an autoimmune thyroid condition. Okay? That's 90% of the people in the United States who have hypothyroidism have Hashimoto's thyroiditis. So, if you want more information on that, just check out video number 2. One of the most common questions I get asked by my clients is, how come my doctor doesn't test me for autoimmune thyroid or Hashimoto's thyroiditis? The answer is because it's not going to change their course of treatment. What does that mean? That means your doctor will continue to do what they've been doing. They will continue to periodically check your TSH and modify your medications based upon one simple TSH blood test. But to determine if you have Hashimoto's, you should be tested for TPO antibodies and TGB antibodies. This is done usually with a blood test. Guess what? Most physicians have no clue on how to deal with an autoimmune thyroid. Again, I'm not trying to bad rap them, but they have no clue on how to help patients with Hashimoto's thyroiditis. Guess what? If you have Hashimoto's thyroiditis, which is the cause of 90% of the time for hypothyroid or low thyroid, you have an immune problem. It's not a thyroid problem. So you must balance the immune system out and not the thyroid gland itself. Keep in mind, the next time you see your physician, because you're dumping more thyroid meds on you, it isn't going to help your immune problem. And the majority of you have been suffering a long time. So what's that tell you? You can't keep doing the same thing and expect a different result. That's the definition of insanity. Well, that's it for this video. If you have any questions about this video, please email me at drkungar@feo.com. Please also go to my website if you're not already there, www.balancingyourchemistry.com. It's under the thyroid tab. Watch all my videos. Make sure you watch the thyroid lecture video #1 for a great overview on how the thyroid works and for more explanation on autoimmune thyroid Hashimoto's. My book, Your Thyroid Chemistry Doesn't Lie, is also available to purchase through my office, through Amazon, or on my website. I'm Dr. Keith Ungar, and I'd like to thank you for watching. I wish you all the best in health.